right. Hi, and welcome to the show, Puzzled Parents, where we talk about all things special needs, neurodiversity, autism, any aspect. We're welcoming a very special guest today. Please welcome Ciara Lewis. Hello, Ciara. Thank you for being here today.
Hello. Thank you.
Oh, my pleasure. Why don't you tell us a little bit about yourself and we'll just go from there.
Well, my name is Ciara and I am from Kentucky. I currently run two businesses. My primary business is medical billing and credentialing, which is KO Consulting LLC. And then my second business is Fierce and Fearless Entrepreneur. It's basically a magazine / a movement for elevating women entrepreneurs in the entrepreneurial space. And that's currently what I do.
Excellent, excellent. That's kind of how we connected was through the magazine.
Yes.
And this is how many issues have you had out so far?
Two going on three. So we are actually getting ready to release the September issue. That will release September the 1st. Along with our podcast should be starting to be released to the public around probably September or 1st of October.
Nice, nice. So I know that you were kind enough to have me in your August issue. I think what I did for you for your particular publication was an article about IEPs.
Yes.
So that was very much something that's on everybody's mind right now. Back to school time, everybody starts thinking, oh my gosh, here it comes. We got to get ready. So I am actually offering an IEP power hour that I'm going to start doing. It's a free course that people can come to just to kind of get a little polished up on the IEP before the school system comes. They can also check out the article in your wonderful magazine. It's so awesome. I just really am so pumped that you guys are doing that and releasing that. So I think you and I had talked about as well that you have a background with your billing, that you had worked in some behavioral health. Tell me a little bit about that.
Yes. So I've been doing medical billing and credentialing for probably over 15 years now. I do have most of my background in behavioral health. I used to actually run a behavioral health business facility. And so, there's a lot of things that I experienced there. Um, I can say that was actually probably my first time truly being that close with our clients, especially because I was not only the billing manager, but the office manager. So, everything came through me. And, I can definitely see where it's a challenge for parents. I can see where it's a challenge for
Mhm.
the individuals. Um, I can see how the public has challenges with it, and I think that this is something that definitely needs to be discussed a lot more, so that everybody can understand, how these
Mhm.
individuals operate and things that might trigger them. Um, I think that was one thing that I learned very quickly there is,
Right.
they have triggers. And if you're not very careful, you never know, what can happen or how they're going to react. Um,
Now, was yours a long term or a short term, or did you have some of both?
it was just an office. Like they would come for their therapy.
Okay.
Um, so outpatient. It was an outpatient office.
Oh,
And
okay.
yeah, and sometimes they may, it's kind of surprising because sometimes they would come and they wouldn't have anybody with them. And so like I said, if you're not aware of this particular individual's triggers or needs or
Right.
behaviors, then again, you could offset very quickly, what might trigger that individual. And you have to be very prepared as to how to handle it. Um, we
What are
would have,
some strategies that you found helpful when you were dealing with people that have these issues that you were feeling like maybe they're getting anxious or it's building up to something that could become a meltdown or behavioral outburst?
I actually created a space in the office to where we were able to take individuals like that if they were uncomfortable being around a lot of people or in
Mhm.
certain situations. I know sometimes they would be triggered by light. So we would have a room that was kind of like a little bit darker, um,
Mhm.
not so overstimulating for the individual.
Right.
We also kept a lot of like I don't know what those toys, those little poppy things. I don't know what they're called, but
Oh,
you know
yeah,
what I'm talking about?
packing, I know what you mean.
Yes, we kept a lot of things
I
like that
can't think of the
around.
name either.
Yeah, I know. Totally drawing a blank. I'm sorry. Um,
I'm
but
sure
yeah, we
everybody will
kept,
know what it is, you just pop them, and yeah.
yes, yes, we kept a lot of things like that around, to kind of help them to re-stabilize themselves. Um,
Right. That was before all the fidget toys and the pop things they have now. I
yes,
remember when those spinners came out, they had the
yes.
3 sides, you'd spin, spin, so oh, that was all the rage when my daughter was coming up through high school, and I made sure to always have something like that with me. We always had things she could do. I always had a snack. I always had something to drink because, like you said, the smallest imbalance
Hmm.
can cause behavioral issues. I know that my daughter saw a psychiatrist, and it's uncomfortable. It's uncomfortable for us when we go, because they're dealing with your issues and they're pushing you in a way that needs to be addressed so that you can kind of deal with those issues rather than just kind of covering them up and ignoring them because they don't go away.
Right.
And I do know that sometimes people with autism, especially, I've had friends whose kids have been hospitalized inpatient for psychiatry because of the imbalance in medications and different outbursts and behavioral issues. My daughter, as an adult, had that issue where she was actually hospitalized for a few days till they got her meds straight. So that's a huge issue for sure. And I'm really glad that we're kind of bringing that up and talking about it today because this is something that parents or loved ones, caregivers really deal with that we really don't talk about because, as we know, autism doesn't live alone. There's always some other what we in healthcare call comorbidity or co-issue going on that kind of interweaves with the autism. There's a lot of oh, what's the word? They used to call it manic depressive. What's it called now?
Um,
Uh, I can't think of it. But
I know what you're talking about though.
yes,
Yeah.
bipolar.
Yeah.
Bipolar.
Yeah. I'll say yeah.
Took me a second, but bipolar is a common one. ADHD, anxiety, all those things, and especially when they're out breaking their routine, there's a higher risk for that. And I know it can be really difficult because as the person that's with them all the time, like you said, you know what their triggers are, you know what to adjust and how to modify your home and environment so that they are calm and don't have those things. So I think it's really great that you guys took the initiative to do that. Do you find that was a common practice throughout behavioral health, or was that something that made your facility stand out?
Um, I kind of feel like that's kind of what made us stand out because, we took the initiative to make sure that when those type of individuals would come in, we were able to provide some type of stability, some type of comfort, some type of resolution for them
Right,
and to keep them, at peace while they're there waiting for their service.
right,
We also would always try to make sure that if we knew they were on the schedule, that we kept everything running right on time. So that way they're not, because again, they can get fidgety very quickly. Especially,
yeah.
if you're not able to keep that train of thought, or not thought, but if you're not able to keep them entertained to a decent level, they can definitely get very fidgety. And
Oh, yes. Yeah, I remember, like, if we go to Busch Gardens, I live near Busch Gardens, Williamsburg, Disney, anywhere where there's a line, not good. Waiting is not good. But I have to give my daughter credit. One time we went on an Alaskan cruise, and so we were in Vancouver getting on the ship, and they had this huge, I don't know if it was a hangar, I don't know what word you would call a terminal, I guess. And there was just ropes, and we were all kind of snaked through this thing because everybody had to go through customs before
Mhm.
they could get on the ship. And we were in that line, I know, for over 2 hours.
Oh goodness.
And she did so well. I think she was just so excited to get on the ship. I mean, it was hard. We always had our backups, something for her to do. But boy, I know I don't like waiting that long, but imagine how amplified that is for a person with
Sure.
special needs.
Yeah.
Um, yeah, yeah. So did you have certain activities for them to do, like coloring books, or what kinds of activities? I know you said you mentioned the pops. What else did you guys have?
Yeah, just like I said, just some little, I don't know what we want to call them, toys, tools. I don't but we mainly kept a lot of things like that. Again, coloring books, snacks. Um
Oh, you guys had snacks too. That's cool.
yeah, we had snacks. I want to say at one point we even had maybe like a TV or something, like to where, we had a room that had like just calming music in it. So we always had like this little noise thing that would play like
Right.
ocean noise, or, something just kind of relaxing. Um, so yeah, we did a lot of different things. Obviously, the therapists were the main ones that would really need to come and intervene if things kind of ever got a little more escalated. But those were the type of things that I would make sure were available and provided, when they would come on come on site. And trying to think, uh it was actually kind of funny because a lot of times people thought that I was the therapist, and I'm like, no, that's not me. I think I've just kind of always known how to deal with people. I guess that's maybe a talent of mine, I'm not really sure, but a lot of people take very well to me. And so I've always kind of been able to either calm people down or, rationalize with people. And so a lot of times they, if they knew I was there or if they seen me, they were kind of like, oh, okay, we're chill, or,
Yeah, like I know this person, I know it's going to be okay. Yeah.
yes.
Did
So
you
I
ever
would
have an
always
instance that escalated to the point where you had to call 911 or something like that?
never to where we had to call 911, but we did have to have two therapists come out and assist, to get them back down to like at least a one or a two. Um, but no, never to where we had to call 911 or anything of that nature. But I always made sure that I showed my face, didn't just
Hmm.
hide in the office all the time. That way, again, they knew that I was present. There would be times that I would maybe even have to just stay out there until it was time for their appointment, just to kind of keep that balance for them. Um, but yeah, it was really interesting. It really was. Just seeing the different ways of how they react, and how they engage, and how they think.
Right.
Because they're definitely very smart, very smart. Um, and so yeah, I really enjoyed that experience because it was something I've never truly really understood or experienced until I worked in that field.
That's good. Can you give our viewers maybe your one big takeaway from that experience? Like if you were to just kind of give them the main thing that you learned through that, or just a pearl of wisdom, we'll say. I know that we're going to touch on billing in a minute, but if there's anything in particular advice you would give to parents and caregivers.
Yeah, I would say it's just very important for us to all be mindful. Even just people out in the community, just be mindful. Remember that we're all different. We all react differently to things. None of us are perfect, and we need to be respectful to the people around us, even if we don't understand their situation, or even if we may not be in agreement as to
Right.
why they have to do something, compared
Right.
to you doing it. Like somebody may have to go in front of the line, or somebody may have to get special treatment. We just need to be
Right.
more mindful and really pay attention to what other people are going through.
Right.
And not be so quick to judge. But that's definitely what my takeaway would be from working in that field.
Excellent. That kind of touches on um, something that came up in a meeting I had earlier today where someone said that we just need to choose not to be offended by so many things. Like just let things roll, you know. I know that I've been out in public or and it differs from age, you know, thinking more towards the younger kids. You're going to see those meltdowns and different things like that. And I really agree with you to where, you know, don't judge that person until you know the situation. And I felt like that before I learned what I know about autism and special needs, you know. Some kid would be having a meltdown or fit in the store and you go, gosh, why doesn't that parent, you know, stop them? Or, you know, they need to be a better parent or whatever. But
Mhm.
now I see it as, well, I don't know what's going on. Is that just a temper tantrum or is that something else? Is that a meltdown? Is that an overstimulation that they can't modulate at that age? And those kind of things. So if you look at it like that, it definitely changes your perspective. So I totally agree with you there. So I know we had talked a little bit about billing because I know that's a huge thing, getting insurances to cover services for our kids. I know I had to pay out of pocket for OT, which was $100 a pop. So the good thing is me being a therapist myself, like I had friends that were OTs and things like that. So I would get a lot of advice from them and my daughter got a lot of free therapy because my OT friends or my speech buddies, I'd ask them questions and they'd give me things to work on with the children. Um, do you see patterns in your billing where it's difficult to, even though you know there's progress or there's things being done or they need that particular intervention, are there particular kind of wording red flags that you come across more often than not? And if so, how can we try to avoid that?
Really, I think it's just kind of hit and miss here and there. I mean, we've had some cases to where we'd either have to get the therapist on the phone or, um, a doctor on the phone or something to justify the service that we're trying to get covered for, an individual. And there's really, I think insurance is just very tricky. There's really no set, oh, if we do this, it's gonna, because what we do today may work, but when we go to try to do it again next month, it may be a problem. And I can say that
Right.
it's something that I have experienced, like we got it to go through the first time or two. Now we're trying to do it again, and now there's a problem. Um,
Mm.
I can say that the more documentation, the better off you are. Um, just definitely, I tell people, don't over document to the point to where it causes questions, but definitely document to the point to where it's very clear as to what is going on with this individual and as to why the individual needs um
Right.
their service. If you under document, then obviously yes, you're going to have very,
Yeah.
a lot of challenges.
That's going
um
to get dinged. That's going to be a red flag.
yes.
Yeah. Yeah.
And just definitely make sure you have a good care team and plan. Make sure they've got case management. Make sure they've got either a peer support or a community support more so. Make sure they've got, those type of services to help along in their treatment because, when you have those type of things in place, it again aids in trying to get certain services paid for. Um,
Right.
and again, it adds more documentation. So,
Yeah. Yeah. That's crucial. I agree. I know I've been in physical therapy for about 30 years now, and I know that that is something that's still, and even more so, discussed than it has in the past. You know,
mhm.
there's a huge difference. I do physical therapy, so I'll use that as an example. there's a huge difference if I document, patient walk 30 feet with walker
Uh-huh.
versus, instructed patient and great training with rolling walker times 30 feet with verbal cues for sequencing and tactical cues for facilitation of, advancement of right leg.
Yes.
So I think it's really important as parents and caregivers and things like that, when you are sitting down in a session or something with your loved one, it's really
Mhm.
important for you to paint the picture for that provider because they only know what you tell them.
Right.
And I think you kind of touched on this a little bit earlier that they're not always reliable reporters. And so they need that input from a caregiver or a parent or someone like that who can really paint the picture that you see. Because, for example, um, people with autism have what's called magical thinking. I don't know if you're familiar with that much, but uh, if you were to say to my daughter, for example, um, she says she's going to go to karaoke because somebody's going to see her and then she's going to be a big pop star. Could that happen? Maybe. Is it likely it's going to happen?
Slim.
Maybe not.
Mhm.
But, if you ask them anything, a lot of times they'll tell you, oh, yeah, I can do that. When I had to help my daughter shower and wash her hair, even when she was older into her teens, if someone asked her, oh, can you get a shower? She'd say, oh, yeah, I can do that. When the truth was, she can do it with facilitation and assistance. And I actually had a laminated chart in the shower that had step by step what she needed to do. And so if they were just to go on what the patient said, oh yeah, I can do that, no problem. That's a very different picture than what reality is. So it's very important to paint that real picture like that. And for us to capture that as professionals, capture those moments and paint that picture with the skilled terminology that's going to get those services covered because they're definitely needed.
Right. And that's why I'm saying it's very important to make sure you have the right team in place for um your loved one or your friend or whoever it is, because if everybody's not on the same page, if everybody's not understanding like what the true need and necessity is for this individual,
Right.
um it's very much so going to throw their care off track. It's they're not going to be able to get the true benefit as to what they really need. And they're not going to be able to live a successful life because they're not getting the proper care or
Right.
benefits. And
Right.
so you definitely want to make sure that between your case manager, your community support, your provider, your therapist, anything, that everybody's on the same page, all the same diagnoses are listed. um, Everybody is aware of exactly to what extent this individual can care for themselves and to what extent they cannot. What triggers does, actually trigger the individual, what does not. And of course, tracking the progress every step of the way. So,
Right. Right.
truthfully,
So are you currently residing in Kentucky?
yes.
Oh, okay, good. I got a question for you, and you may or may not know this. This just kind of popped into my head. I live in Virginia, so I'm very familiar with the resources and things that Virginia has to offer someone with special needs. You
Mhm.
mentioned community care. Can you tell me a little bit more about that? Because every state kind of has their own thing.
Uh-huh.
And are you familiar with like what is the case manager's role in your state and the community team? Tell us a little bit about that so I can kind of get an idea of what your state has to offer. And I'm not saying this is an end all be all, but just from your perspective, what you know.
Yeah, so our case managers, they basically oversee the full case for this provider, or I mean for this client. So again, they communicate and have, most of the documentation from the providers. They again know this individual's front and back needs, triggers, all of it, medications, um, past history, behavior issues. They know all of that. And so they kind of help keep all that in balance, and they work with the different providers to ensure that the individual is getting the proper care and benefits that are, out there for this individual. Um, Community support, basically they would come and take the individual to wherever they need to go. So whether it might be an appointment, or maybe they just want to get out and go to the park, or go to the library, things like that. That's kind of what community support does. But again, it works hand in hand with the
Mhm.
case manager.
Right.
Um, and so basically, like I said, once you build your team like that, it benefits the individual because they're able to get that full support that they need
Right.
to be able to have a
Right.
functioning life.
So it sounds like that community support person's kind of like a personal care attendant or aide, where they would come out and help support the person in the home. Now, did you know if they work on like life skills, like helping to
Yes.
make sure they're taking their meds and cooking their meals? And, you mentioned transportation. That's a big one, especially if you're in a rural area like we are. Do you know if that's covered through Medicaid, or do you all have Medicaid waivers that you know of?
Yes, we actually have both. So we have like the Michelle P waiver. There's another one too. I can't remember exactly what the name is off the top of my head. The Michelle P waiver is a really big one though, but we have the Michelle P waiver. We do have Medicaid. Yes, those services are covered. And depending upon the exact type of care the individual needs and the age that the individual is, it's
Hmm.
going to depend on whether they need the Michelle P waiver or whether it would strictly go under the Medicaid and be covered that way.
Right.
With the different type of Medicaid that they would have. But
Right.
yes, we do have those type of programs here in Kentucky.
Okay, wonderful. That's really good to know. Here in Virginia, we have regular Medicaid, but there's also Medicaid waivers. There
Mhm,
are, I believe, three of them now, and it depends on. It used to be two. You used to have intellectual disability and then developmental disability, but they've changed it into three.
mhm,
So it depends on what kind of support you need as to which one you would qualify for. And they actually have a waiting list, which this is important to talk about too. My daughter actually sat on a waiting list for a waiver for 10 years.
oh, mhm,
So if I hadn't started planning early, she still wouldn't have it because she was officially diagnosed when she was 10. And that's when I started researching and planning. And I actually ended up working for Medicaid for about 6 months as a case manager. So I got trained right up here in Richmond, straight from the horse's mouth.
mhm.
um, but it is really important to research and know what your state or wherever you live has to offer to support that person. Does your state have what I call supported living, which it's not really a group home, it can be an individual apartment, but they have it where um like they have the aide coming in to make sure that you're keeping it clean and you're doing your hygiene and all that stuff. Do you
Yes,
have special communities like that?
yes, we do. Uh-huh.
Excellent.
Actually, um the practice that I worked at, or was overseeing, they actually also had a house, like a housing type thing for individuals like that as well. Um, so yeah, we do have several programs like that here in Kentucky.
Cool. Was that like a group home where a bunch of them lived together, or it was more like individual apartments in a building?
I think they had both from what I remember and understand. I didn't really work on that side, so I can't say for certain, but I
Okay.
want to say that they had it set to where there was like individual and maybe a mixture of housing. Um, so yeah, I think so. And
Okay.
even outside of that particular one, like I said, I know there are other programs to where that is a thing. Um, but I think with her program, I think she had it set as both.
Gotcha. Well, thank you so much for sharing that. That's good to know. Excellent information. This is why we network. This is why we research, because you never know. I
That's
mean,
true.
I didn't know that information at all. I mean, if you would ask me about Virginia, I consider myself a pretty good expert on it because I was trained directly by Medicaid in Richmond. And I actually last year they tried to take my daughter's waiver away and I appealed it and we had to go to a hearing and everything and it was overturned. I won. So but I couldn't go to Kentucky tomorrow, and do
Mhm.
that because I don't know the information. So that's really, really fantastic. Thank you so much for sharing.
You're welcome.
Um, Tell me a little, let's kind of change gears a little bit. Tell me a little bit more about your magazine. I know we touched on it at the beginning. You said you're building up entrepreneurs. Tell us about that.
So like I said, I've always had a passion for helping people. And so this is something that the creator was like, hey, this is your new assignment. And so I'm like, okay, here we go. But I basically started this magazine just because I feel like there is definitely a lot of negativity in the space of women and a lot of competition. And
Mhm.
I feel like we can do such a much better job than where we are right now. I still see a lot of these, women groups popping up, but yet I'm still seeing the negativity. I'm still seeing the competition, being pinned up against each other. And not only that, but I'm also a victim of domestic violence. And so, I also want to have a space that is safe for women to come and share their voice, their
Mhm.
journey. Just know that they're not alone and that they've got someone standing next to them. So basically, we're just creating a foundation, a support system for women, helping them to elevate into that next level of their career, or even just that next level in their life in general. Take them back who they are and just really stepping back into who they are and owning it. And that's basically what we're doing.
That's awesome. I love that. I love that. I know myself, I'm out in that woman entrepreneurial world, and you're right. There's a lot of that competition versus collaboration, and it's
Yeah.
really important to find those resources and venues and platforms where it is that kind of you lift me up, I lift you up, we all rise together. Your win's my win is your win. That's really, really fantastic. Thank you for doing that. That's so needed for sure. And
You're
your
welcome.
magazine was Fierce and Fearless, and the August issue is out. And where can they find this fabulous magazine?
It is actually on Amazon, Barnes and Noble, Walmart, Target. There's a couple other ones that I can't remember the exact name, but those are the major outlets that you can actually shop and find the magazine on. The paperback or the print copy is not actually ready quite yet. Should be ready to be released within the next week or two. Um, but yes, the digital copies are ready for July and August.
Excellent. And you mentioned you have Facebook pages too, correct? Facebook and Instagram, I think you said.
Yes, and the name for both of those are Fierce and Fearless Entrepreneur. And the word "and" is spelled out, so it's just spelled all the way out, Fierce and Fearless
Right.
Entrepreneur. And then the website is
Excellent.
fierceandfearlessentrepreneur.com.
So if someone had an idea and they wanted to try to connect with your magazine, that's where they would go is to the website and you have a contact link on there.
Yes.
Excellent. Well, I thank you so much for being here today. I really feel like we touched on some things that haven't been touched on with any other guests, and that's really what this platform is about. Is just, hey, we're just going to get real and raw and authentic and just talk about aspects of life because, like I said, there are so many aspects, especially I have the perspective of being a parent and a healthcare provider. So I see a lot of those things that we just don't talk about,
Right.
you know. Oh, one tip I did want to mention to you parents, where if you are getting your child evaluated for a Medicaid waiver, there's here in Virginia, and it's probably in most states, they have some kind of evaluation system to see if you qualify. Make sure that when you answer the questions, that you answer it based on your child's worst day or if they were not on their medications. Because on a good day, we like to see the positive and growth and progress in our kids. That's awesome. But we have bad days too. So you have to answer the questions, going back to the one I talked about earlier. Can you get a shower? Answer the question as if it was your child's worst day and or without their meds. So that's a helpful tip to take away from there. Thank you again. I appreciate you taking time out to come by and talk with us. And everybody look for that magazine. Go out and get you a copy. Digital's available now, which is August of 2025. So if you're looking for that, it'll be out and you can always order it. The e-copy it's on Amazon, right?
Yes, it is on Amazon. Mhm.
Amazon, and then look out for the paper copy. All right. Thank you so much, Ciara.
Thank you.
All right. Bye, guys. Stop.